Hi, my name is Mandy Kass. I'm a certified genetic counselor with Ironwood Cancer Research Centers. A lot of patients, when they're first diagnosed with cancer, might consider getting their own genetic testing done to better guide treatment decisions or determine if their family members are at risk for cancer. So today I'm going to be talking about the 3 different types of genetic test results that we could get back from that type of genetic testing. Specifically, the type of genetic testing that I'm going to talk about today is a hereditary type of genetic test, or sometimes we call it germline genetic testing. And it's a test that analyzes pieces of someone's DNA called genes that they inherited from both of their parents. Specifically, this test looks at genes that someone was born with that are supposed to be protecting them from certain cancer types. So if someone is born with a copy of one of these cancer protection genes that is mutated or it doesn't work properly, that would tell us that that person was born with a higher risk to develop cancer. Now, it doesn't guarantee that that person would develop cancer in their lifetime, but again, it does tell us that the risk for that person would be higher because their body has less protection from those cancer types. The first type of genetic test result that we'll talk about is a negative genetic test result. Now, a negative genetic test result means that we don't identify any hereditary risk for cancer within that person. So all of the genes that we look at appear to be normal. Now, there's different ways that we might interpret someone's negative genetic test result. The first is that maybe that person truly does not have an inherited risk for cancer within themselves or their family. Another possibility, though, is that there is still a hereditary risk for cancer within that person's family that maybe they did not inherit. So maybe that's why their result is negative. Another possibility is that maybe there is still some genetic or hereditary predisposition to cancer within that person that our technology isn't able to identify. Or maybe there's a gene out there that we just haven't discovered yet and wouldn't be able to look at. So because we don't always know which category someone falls into, we do still have a couple of recommendations. The first recommendation that we make for someone with a negative genetic test result is that they consider updating their genetic testing in the future to account for any changes or improvements in technology. Another thing that we recommend for patients is that they consider basing their screening plan off of their personal and family history of cancer. So, for example, if someone has a negative genetic test result but still has a strong family history of breast cancer, we might still recommend that that person consider increased breast cancer screening to account for that family history of cancer. So, even though a negative genetic test result can be very reassuring, we still might want to make a couple changes for patients based on their personal or family history. Another type of result that we oftentimes see on genetic testing is a variant of uncertain significance. Basically, what this result means is that when the lab looks at someone's DNA, we oftentimes find some unique genetic variations that people have that we're just not familiar with yet. So when that happens, the lab will include that information in someone's test report, but we don't actually do anything with that information. Instead, what happens is the lab will continue to research that unknown finding. And over time, if they're able to determine what it means, they will send us an updated report. So we'll certainly get in contact with you if there's any important updates for you or your family that we receive in the future. So because of that, we always recommend that patients keep their best contact information up to date with us, so that way we can reach you if we need to in the future. But the big thing with these unknown results is that majority of them will ultimately be determined to be just a normal genetic variation. So that's why we don't want to make any screening changes or treatment changes for patients based off a variant of uncertain significance, because of the really high likelihood that it's actually just a totally normal part of your DNA. The last type of genetic test result that we're going to talk about is a positive genetic test result. A positive genetic test result means that we do identify some kind of genetic mutation or variation within a copy of a gene that is supposed to be providing protection from certain cancer types. A positive result could be used in a few different ways. Firstly, if someone has a diagnosis of cancer, we might be able to use their positive genetic test result to determine better treatment strategies or possibly make some surgical decisions as well. Next, we can use the information to determine a more appropriate screening strategy for patients based on their personal cancer risks. So, for example, if we do this testing and we find that there's a really high risk for colon cancer based on a specific genetic variation or mutation, what we'd want to do is make sure that we're starting colon cancer screening earlier for that patient and probably doing that screening more often. So maybe instead of colonoscopies beginning at age 45 and being done every 10 years, which is the general recommendation, we might say that we're going to start colonoscopies at age 25 and do them every 1 to 2 years. So the goal there is that if something were to develop, we'd hope that we're going to catch it at the most early treatable stage. Lastly, we can use the information from a positive genetic test result to better determine if other close family members might have those same inherited cancer risks. So most of these hereditary cancer predisposition syndromes follow what we call an autosomal dominant pattern of inheritance, which means that if someone has a hereditary risk for cancer, that would mean that there's a 50% chance that their kids might have that same increased risk. There's also a 50% chance that their full siblings might have that same increased risk. We'd also assume that one of those parents of that individual would have that same hereditary predisposition, and possibly people on that respective side of the family as well. So it's important that we're offering genetic testing to these family members so that way we can determine if other family members need to make changes to their screening plan. So a positive genetic test result can certainly sound scary at first, but the big thing to keep in mind is that a positive test result like this can actually provide us with really valuable tools and insights on how to best keep you and your family members safe from different cancer types. Genetic testing is a personal choice, and it's certainly not for everyone, but at Ironwood, we do believe that knowledge is power, and it really does help us better guide treatment and screening for you and your family. If you've got any questions or you have a personal or family history of cancer, please feel free to talk with me or another certified genetic counselor about that history.